All right. Good morning, everybody. Dr. Rafich here from Vet Triage. It is November 3rd, 2024, Sunday, 8:58 a.m. Pacific time. We are going through this issue of JAVMA, the May 15, 2018 issue. We're going to be talking about pathology in practice. Look at that gross thing there. And let's get into it. 7-month-old female peahen was sent in for necropsy. Prior to death, there were no symptoms. On the same location, 10 out of 11 of their peafowl had died, and none of them had clinical signs either. When they submitted the body of this bird, they found that she was emaciated. She had depressed pectoral muscles, meaning some sort of muscle loss or atrophy, and the keel bone was prominent. The keel bone is like the sternum of birds, and so if the pectoral muscles that normally hug the keel bone are depressed, then the keel bone is more prominent. Also, if they're starving, they'll usually lose weight over that area as well. The muscle looked like necrosis. The liver had a few capsular, multifocal, 2 to 3 millimeter diameter, occasionally slightly raised, irregular yellow foci. The ceca, so the cecum, was enlarged with multifocal transmural areas of necrosis, white to yellow discoloration, and the mucosa was ulcerated. So this is the outside of the ceca. There it is in birds. It's I guess there's 2 of them. That's why they say ceca, plural, and so cecum, which is singular. The histopathologic findings include that the ceca were necrotizing, they had inflammation, it extended transmurally into the serosal surface. There were cellular debris, heterophils, which are the equivalent of neutrophils in mammals. Birds have heterophils instead of neutrophils. Fibrin, bacteria, macrophages, plasma cells, lymphocytes, and they found 8 to 20 micrometer diameter size protozoa. They were the trophozoites. Protozoa, there's 4 types of infection you can get: bacteria, viral, fungal, and protozoal. And I guess parasitic, like worms. But protozoa have different life stages, and trophozoites are usually, from what I can remember, the active life stage when they're like actually destroying tissue and trying to thrive. So they diagnosed it as Histomoniasis meleagridis, which is a protozoa. Lymph vessels were dilated with macrophages. They found liver necrosis. They found in the liver heterophils, lymphocytes, macrophages, and more protozoa. So the diagnosis was bilateral marked diffuse necrotizing ulcerative transmural typhlitis, which is inflammation of the cecum or ceca, with intralesional protozoa, multifocal necrotizing cholangiohepatitis with the liver, and focal coagulative necrosis and mineralization of the muscle, the pectoral muscle. And for those who are interested, and you can see it, those arrows are supposed to be pointing to the protozoa. And here's another one where they did special staining for it. So you can see all the pink areas that light up. That's the protozoa. Comments. Histomoniasis is known as blackhead disease. It is due to methemoglobinemia. So that's when the hemoglobin of the red blood cells can no longer carry oxygen normally. And so instead they carry methemoglobin. And that becomes obviously deleterious to the bird because they are not transporting oxygen. So they get cyanosis, which creates a blue-black tinge to their skin. That's why it's called blackhead. So it results in cyanosis, and they get a gray or blue skin color on the head. You can also see drowsiness, sulfur-colored feces, and fever. You want to use H&E or periodic acid shift stains, among other stains, to allow detection. That's that purple in this picture, the bottom one. They use special stains for that. And it'll show you that the protozoa are eosinophilic, meaning they have kind of a pinkish hue. They are 5 to 20 micrometer diameter sized. They have flagella, so little hairs on it they use to swim with. And they also have a basophilic central nucleus. Basophilic means they're slightly purple or blue color to them. The protozoa in birds affect those of the order Gallitorms. That includes chicken, quail, pheasants, turkeys, grouse. Peafowl are related to turkeys, usually to oral or cloacal exposure. The Histomonads, which is another stage in the life cycle of the protozoa, they replicate in the ceca. The ceca starts to slough and they lose proteins, blood, debris. Then it enters the portal system, affects the liver, then kills them. It sheds in the feces. In the gallinaceous birds, the protozoa may be visible in affected tissue 5 days after infection. Cloacal application occurs by day 3, cecal lesions day 6, liver day 6 to 8, death between 13 and 15 days after infection. Cloacal infection with eggs of the cecal worms, the worms are called Heterachus gallinarium, containing histomonal stages, seems to delay development of the protozoal lesions by a few days. So mortality is 19 to 21 days after infection, instead of 13 to 15. So meaning that if the bird gets exposed to the worm and the worm has a protozoa, it delays the speed at which the bird gets sick. Clinical signs will then be 6 days, death in 10 to 15 days if you feed them orally with the protozoa. The worm can be harbored in I see. So the worm that we mentioned can also be one of 3 species of earthworms, such as houseflies, grasshoppers, and sow bugs. The cecal worms have been shown to contain histomonids by both light and electron microscopy, as well as by reinfection of turkeys with cultured cecal worms. The worm eggs can persist in the soil for up to 3 years and remain positive for the protozoa for up to 150 weeks. Wow. Oral gavage with as few as 58 heterachus, so those worm eggs per bird, and feeling whole cecal worms or contaminated earthworms can result in disease. The low pH 2.2 of the proventriculus and gizzard in turkeys is thought to limit the passage of the protozoa to the ceca in the absence of a cystic or vectored form. So I'm guessing cystic or vectored. Vectored means it's being passed along by another organism. So in this case, the worms. So the worm can protect the protozoa from getting dissolved by the acidity of the gizzard and proventriculus of turkeys. And cystic forms means that if the protozoa is in its cystic phase, which is usually called bradyzoites, then they are more protected around the harsh environment of the acid in the stomach. However, they may occur only in low numbers in natural settings and under certain conditions, such as decreased environmental temperature or factors adverse to growth, or under specific conditions inside the cloaca of infected animals. This disease may also be transmitted amongst turkeys via cloacal drinking, which is a reverse peristaltic action produced by a physical stimulation applied to the cloaca. Disease transmission without the use of vectors has been explored, and a lateral transfer, meaning bird to bird, has a rate of 33%. Higher rates of lateral transfer have been observed among healthy birds commingled with infected birds that are housed on paper or pine shavings compared with bare wire floors. Researchers concluded that the buildup of infected fecal material on bedding allows the contact between turkey vents and feces, thereby resulting in cloacal drinking. Very gross. This protozoa is found to remain viable for as long as 6 hours on straw, and it could be viable on turkey feathers and feed, and as long as 9 hours in non-chlorinated tap water and fecal material. Chickens seem to be more resistant to it. They only develop mild to moderate histologic lesions. They can serve as carriers of the worms. Chickens have an earlier and more emphatic immune response to the presence of the protozoa than do turkeys, so they get less severe signs. Chickens upregulate interleukin-1 beta and interleukin-6 within the first 5 days of infection, followed by interferon gamma and interleukin-13. So cecal lesions don't happen until 10 days after, and they can start healing by 12 days. Those chemicals that I mentioned, interleukin-1 beta, interleukin-6, interferon gamma, and interleukin-13 are called cytokines, which are proteins in the body. Cytokines are involved in infection, inflammation, immune reactions. They're an important part of the immune system. But turkeys, however, don't upregulate the production of these cytokines. So until about 4 to 5 days after infection. So the cecal lesions are seen as early as 3 days after infection. The production of cytokines increased at 7 days or more in turkeys post-infection. Liver lesions in chickens can also appear, and chickens can survive to become healthy carriers of the disease. Wild ducks can serve as another carrier. The mule and Muscovy ducks in Europe have been shown to have cecal contents for several weeks after infection without any symptoms. Other birds include chukars and bobwhite quail. They've done PCR assay of liver tissue in those birds. They've also found cecal worm sections in those birds. The aid of anti-flagellate feed additives and the pharmacological treatment of this disease in the mid-2000s by the European Union was banned for use of all therapeutic and prophylactic measures against this protozoa in food-producing animals, so the infection rate went up. Causes of necrosis in the skeletal muscle in this bird include nutritional myopathy, so vitamin E and selenium deficiency, toxic myopathy, exertional or capture myopathy, and IM injection or intramuscular injection. So I'm curious as to why they decided in the mid-2000s to ban the use of it. I usually, with food-producing animals, if they have certain chemicals, medications, compounds in their body that can then be spread to humans who are going to ingest them, or I guess animals, but and it's deleterious to those animals that are going to eat them, then they usually ban them. And so I'm assuming that there's something like that with the banning of these drugs. But anyway, it's a pretty unique case of a bird. And yeah, I'll see you guys again tomorrow on Monday. Thanks. Take care. Bye.